Hello everyone. Today I have a few staff members present with me. They include the DON, the AIT, and a CNA. I want to thank all of you for coming and listening to my small presentation about one of the most important topics right now, infection control. It is also our policy that we wear masks from the time that we enter the building until the time that we exit. We as nurses must continue to look for ways to impact the change within the healthcare system. This trend requires having nurses to have the latest information so they can properly care for their patients. As we all know, this COVID-19 pandemic has been crazy, and it has forced the world to face a new normal, and the delivery of the healthcare system has been severely impacted. The biggest impact on change right now would be to reduce the risk of infection. Currently, we have restrictions in place to prevent the spread of infection. These include using PPE properly, enforcing social distancing between the residents, canceling all group activities, and restricting visitors. That's a big one, especially in long-term care, because all the residents want nothing more than to see their family and vice versa. All healthcare settings should have a policy in place related to hand hygiene. Our current policy states that all personnel should wash their hands when visibly soiled and before and after a known suspected C. diff or infectious diarrhea case. Hand hygiene should be performed before and after patient care, before any procedure, after any contact with blood or bodily fluids. The proper way to wash our hands includes wetting the hands with warm water, applying soap, and rubbing the hands vigorously for approximately 20 seconds. Longer is better, but should last at least 20 seconds. Applying the science behind the matter. This is an important approach to achieving sustained hand washing behavior, because we want to form a habit out of this. A realistic goal would be initiating hand washing behavior, and adhering to infection prevention is crucial because we want to provide safe and high quality patient care. The frequency of infectious outbreaks stems from errors related to infection control issues, and we all know that. We see that lots and lots. Indications for hand hygiene during patient care would include washing your hands when they are visibly soiled, or you may use alcohol-based hand sanitizer, and this is an acceptable way to clean your hands when they are not visibly soiled. For hand hygiene to be effective, it must be performed regularly and correctly. An interesting fact shows that two different parts of the brain are actually involved in the drive of hand washing. The first part is the neocortex, and the second is the basal ganglia, which automatically drives behaviors. Just crazy little fun fact for you there. A goal would be to do whatever it takes to ensure the safety of our patients, and also having staff adhere to the policy, which would be reducing the risk of infection. While discussing the infection control issues with the administrative team, a realistic change that would be implemented will include small posters hung throughout the facility and on the outside of residents' rooms for those who are in isolation. This will be a reminder for all staff on what personal protective equipment to wear upon entering the resident's room. As you can see here, I have this little poster, and if you're unsure of what to wear at any time, you can always go to the nurse, and she'll be more than glad to provide you with that information. Also, I have come up with a list as a hand hygiene and contact precautions observation, if you can see that. I have a little key code at the bottom which talks about who's entering the room. It'll be good for the infection control nurse when she's making rounds. Did the staff enter the room? At what time did they wash their hands before and after a procedure, after any contact with the patient? Did they properly put on their gown, dispose of the gown, proper way to don and doff PPE, which is very important, which led me to doing this presentation, because after discussions with the CNA, it's actually really surprising how many people don't understand the proper way to put on and take off PPE. Yeah. Also, we would like to integrate this infection control program into the facility's management improvement program, and to provide education to the staff regarding appropriate infection prevention procedures. Each morning before assignments are taken, nurses and CNAs will be reminded to use appropriate PPE throughout the day. A lot of times CNAs get into hurries and think that they can just sneak into a room and complete the task and no one will see them, and don't realize the danger behind it. Compliance with hand hygiene practices by nurses after social change and preventing infection, which means that the practice is becoming enriched into their daily practices. We have yearly competencies, and maybe these competencies should be done more frequently. A lot of times it's in one year and now the next, because these girls are assigned to so many patients that time is limited. The quality and safety education for nurses never stops, and these are proven techniques that each of us should take that could ultimately save someone's life. So thank you for coming to this little presentation. See you guys later.